Let me hit record and we're good.
Being recorded.
All right, everybody, this meeting is being recorded, so you can talk to your coworkers and get them to review it if you think it's worth going after. I'm sure it will be. Donna does a great job in finding innovative new caregiver advocates from all over, and she's tirelessly looking for people to speak to us. We have our speaker for next month, and she'll probably preview that when we get to Kevin. A few things. We'd like to welcome our new members. I'm having vision problems here this morning, sorry. Kimberly Whiter from Elder Care Solutions in Roanoke joined us in January. We'd like to welcome her. Thanks for joining. Mary Arthur is a dementia-focused options counselor, joins us from Bay Aging. And Ursula Garcia Mays is the program director from Cornerstone Care, joins us as well. She was introduced to us by Ellen Phipps, who's on the call today, and we thank Ellen and thank Ursula for joining us. What we like to do, Kimberly, if you would, just tell us a little bit about the work you do, and then we'll go to Mary and Ursula as well.
Sure, absolutely. So Elder Care Solutions is helping families with the financial strain of taking care of an elderly loved one. Predominantly, it's the family caregivers that come our way, although sometimes it can be the seniors themselves. That's just a much less likely situation. So we are predominantly working with like the adult children of an elderly loved one, and we're giving them strategies and options to overcome the overwhelm and the unsustainable cost of elder care. So if anyone is interested in learning more, I'd be more than happy to meet one-on-one and we can go in depth. And I always look for creative ways to like partner with people, because the more that we can know about each other, the better we can help everybody. Thank you.
Thank you, Kimberly. Thanks for joining us and look forward to working with you. Mary, how about you? What are you up to?
Good morning. So I'm Mary Arthur, and I worked in long-term care for about 15 years. And so I was really excited to go into the community living aspect of things with Bay Aging. And so we service the Northern Neck and Middle Peninsula. But I was a caregiver around 18 years old for my grandmother who had early onset Alzheimer's, and it was very, very difficult for our family. Since then, all 7 of her siblings have died of Alzheimer's. So we have a huge family impact. And we know that we have the genes in our family. And so I've been running support groups through the Alzheimer's Association for about 7 years. And I'm a dementia care trainer and consultant. And so in the first 6 weeks of coming into this job, we had over 40 referrals from caregivers. About 95% of them were caregivers for people living with dementia. So I've already I've seen now what the need is. So I'm really happy to join the Caregiver Coalition. And we're trying to create a caregiver advisory council for the Northern Neck Middle Peninsula. We found that with the US Census, our area is number 6 in the United States for the most aging population over 65. So we have a lot of people that retire to the water country, right? But we don't have the housing or the nursing aides to help them. So it's been eye-opening. So thank you for having me.
Oh, thank you, Mary. And I will be reaching out to you. I have a client in Northern Neck who could use your services. Ursula, how about you? What have you been doing?
Hello, everybody. I'm Ursula Garcia Mays, Program Director for Cornerstone Cares. Our focus is on educating and providing resources and respite for our caregivers. Initially, this started out very local, just in the Warrenton area, and we've kind of branched out a little further. Culpeper, Rappahannock. I even had a client call from Linden. And so our goal is to provide the caregiving community with education through webinars, soon in-person events, but most of them are by Zoom now. And we're providing respite to the local families. So we have a group of volunteers At this point, most of them are from Cornerstone Baptist Church, but we are looking outside for volunteers to just give the caregivers a break. Just 4 to 6 hours per month is all we're asking. We do provide training for the rest of the volunteers. And just a little bit of background on me, I am a caregiver on so many different levels. My grandmother had pancreatic cancer, and this was 15 years ago. So I was her caregiver the last 18 months of her life. My mother passed in 2020, and then my dad just passed recently in right before Thanksgiving, 21. And so now I am a distance caregiver for my mother's twin sister, who lives about an hour or so away from me. So it's rewarding in so many ways. I love what I do. I'm very passionate about what I do and who I do it for. But we're always looking, Cornerstone Cares is always looking to engage with others, to see if there are other resources that we may not be able to, that we may not have, but we can tap into other resources, engage with other organizations to help our families, to help our caregivers.
Thank you so much, and thanks for joining us.
Thank
Wonderful
you
to
for
have
having
you.
me.
Okay, just any other new members that I missed that haven't had a chance to introduce themselves? Okay, well, let me just quickly cover. There's some items here. There's a family caregiving for people with cancer and other serious illnesses, a workshop on May 16th and 17th. I think Liza sent out a blurb about this, so check your inbox, and if that's coming up in May. George Mason University has been working with the Music and Memory Project. This is a program that's brought support to many dementia patients, and I think any of you who have worked with people with dementia understand more and more the importance of music as part of their care and how soothing it can be for them and reduce agitation. So the let's see, the project study, they're looking for they're launching a new grant-funded initiative to study associated states of stress relief for caregivers. The project coordinators are looking for caregivers who would be interested in participating in the project. Again, the information on this can be posted. Nick, can we put it over in the chat box? Liza, you sent this out already, right? Yes. So check your inboxes about the George Mason University Music and Memory Project. Henrico County presents Brain Health and You, a conference on Tuesday, April 19th from 10 a.m. to 1 p.m. at Deep Run Recreational Center. There will be an education and presentation portion from beginning at 10 a.m., followed by a vendor fair portion. The Virginia Caregiver Coalition will be participating in that, along with the respite voucher program. So Nick gets a day out of the office there. So let's see. Does anybody else have any announcements at your organization about events that you'd like to share with the attendees? Yes, David.
Hey everyone. I just saw that ARP is doing an event for caregivers. Let me see if I can find the information. March 24th through 26th. And it's obviously online. And it's got a load of folks that are going to be speaking. Dolly Parton and James Patterson will talk about their new book. Amy Poehler and Tina Fey will be interviewed. It's kind of like take a break sort of thing. It's not educational as much as it is for caregivers to take a break. It'll have a caregiving theme. The Commodores will play. Rod Stewart will do a little concert. There'll be a dance party. If you guys have never been a part of a Daybreaker dance party, they get like 10,000 people on at once. If you want to be on camera, you raise your hand on Zoom. And so they sort of circle through different people being on camera, and people dress up in costumes, and they have signs to say where they are and how old they are. And it's just huge energy. And so it's a great break. So Gary Sinise is talking, Gloria Gaynor will be there, Valerie Bertinelli, just goes on and on. March 24th through 26th. If you want information, you can go to, I think the best place to go is aarp.org/VCC. VCC stands for Virtual Community Center. And the Virtual Community Center doesn't always do things just for caregivers. They did 187 events in February, 337 events so far in 2022, and about 60,000 people participate a month. So it's things that you can learn, like brain health, also some caregiving things, but things that are just for fun, like tours of museums and things like that. So it's more of adult education than it is focused on caregiving. But that's an event coming up. Thanks.
Thanks, David. That sounds great. Sounds like it'll be fun. Anyone else have any business? Yes, Ursula.
I do. I just wanted to, on all this is short notice. We are having a webinar Saturday morning at 10. We're having someone speak to our community about the Medicaid waiver. So if you have anyone that's interested, have them, reach out to me. I have my information in the chat and I can get them registered for that.
Okay, thanks.
And I have to just piggyback. AARP is amazing. I am looking forward to the salsa dancing next Thursday. Thank you.
Okay, anybody else? Okay. Yeah, go.
I was just going to say that I added in the chat a little bit more details about the Brain Health and You conference that you had mentioned. That's something that my office is putting together. And I just wanted to be clear that that event is geared towards older adults age 60 years and older and their caregivers in the who live in Henrico County. So just so everybody knows.
Okay. Thanks, Emily.
Chris, we're hosting a program on April 21st called What's Normal and When Should I Be Worried with UVA neurologist. I know a lot of times with caregiver stress, caregivers themselves start worrying about if they're experiencing signs of memory loss or cognitive impairment. So that's going to be a Zoom. And you can find out more details or sign up. It's free, but you can register at agingtogether.org.
Thanks, Ellen. Okay, anyone else?
Hi, this is Sharon. Just wanted to, because meeting wise, we have, I'll send the flyer to Nick when we get it, but the Greater Augusta Coalition Against Adult Abuse is doing their annual education seminar regarding elder abuse and neglect, scams, those type things. It's a day-long program. It will be May the 11th. It will be virtual, and when we get the final flyer, which should be by the 1st of this month, I'll send it to Nick to send it out to everybody. It's free to register for. Since we're doing it virtually, even when we do it live, we usually have about 250 people. Wow. But doing it virtually, we have a lot more people. We have speakers from across the country, along with folks from the Attorney General's office and some other individuals talking about also mental health and issues related to dementia and individuals trying to get TDOs and ECOs and how the hospital is responding. So I'll make sure everybody has that information, or I'll send it to Nick and it'll have registration information on it. It's free. I think there's a thing on there if you want to make a donation, but otherwise it's free to anybody that wants to attend. We will have certificates of attendance for anyone. And because it's co-sponsored with the Department of Social Services, anybody who needs additional credits or needs NAB credits or those things, this all qualifies for it.
Okay. Anybody? Okay, thanks, Sharon. All right, just a quick note on some new business. After this meeting, we're going to send out a survey with the slate of our new officers, along with a little biographical information about each of them. And I'm proud to say that we have attracted some terrific talent to take the reins as chair and vice chair and secretary for the next couple of years. And so please look for that survey. We would like to approve this slate with the, with the full membership if we can. And so if you have people that you work with that are members, but maybe don't make the meetings, bring this to their attention. We'd like to get full participation in this election. So really looking forward to working with these folks. And so please participate and look for that survey. Donna, do you want to talk about some the upcoming education programming?
So in May, we're going to be hearing from Andy Platia over at the Division for Aging. She's going to be talking to us about her program that's called A Matter of Balance. And I'm really excited to hear from her because I heard her do a lunch and learn and I really enjoyed it. And I think you all are really going to enjoy it too. And I think you'll be able to use it with the people you work with. And so that's all I've got coming up so far, except of course for today.
Yes, and we'll get you to introduce Kevin in a minute. Moretta, are you on? Okay. So Nick, any updates on the voucher program?
So Liza, how many people are we at now?
186, but by the end of the week, probably over 200.
So that's 200 people approved for the program. Our goal is 500 or 1,000 over 5 years, which is about 250 a year is what we're kind of aiming for. So that's awesome that we're getting so close to our goal so early. The most recent updates is, as anyone who was on the last meeting, Liza and I have finally converted all of our application and reimbursement material to PDF fillable forms. And I've finally figured out how to distribute those to people to fill out and hit submit, and then it will automatically bring them back to us in a way that I can export them into Excel, which should make Liza's job doing data entry and keying in hundreds of questions a lot easier and more automatic. So we're really excited for that. I'm still working on trying to figure out how to send it out, what it looks like to people who receive it, and how to navigate them through Adobe Acrobat, which you do have to have at least the free version in order to complete those forms. So obviously, if you don't have internet, that's going to be a challenge. So we're still trying to navigate that and just make it more efficient for everybody.
Nick, you just got muted.
Oh, did I?
Doesn't say we're muted.
Can you hear me again?
Your internet connection.
Yeah.
Oh.
Okay. It looks like the Wi-Fi here is trying to act up again.
I'll get on.
So yeah, we're excited about that. That's kind of the only updates from VLRVP. The only other thing that I would like to mention today is a while ago, Gordon Walker had reached out in regards to a CARE Act informational wallet card that AARP had kind of run and done a flyer. I had mentioned that, we were doing elections, so that was going to kind of sideline some of that for a little while. But he was asking if the VCC would be interested in possibly partnering with the AARP to print our own version of the flyers and be able to print and distribute them for people. Essentially, the CARE Act, in short, allows care recipients who are admitted into the hospital, it gives them certain rights about appointing caregivers and notifying them upon discharge. So there is a flyer. I'll also share that at the end of the meeting, and it'll go in with the minutes. So it's something that I'm kind of interested in doing as long as we can figure out the funds for printing and distribution. So stay tuned probably during the next meeting for more information about that.
Nick, I have the funds.
Oh, you do? Oh, wonderful.
Yeah, I have. I mean, I guess I can't say, but I've got a couple of thousand anyway.
Okay, wonderful.
And, you know, the CARE Act was passed in 2015. And it's not just to notify you when your loved one is discharged from the hospital, but it's also to provide an explanation and a demonstration of any medical tasks that you as a caregiver are being asked to perform at home. And that has to be in your native language, and it has to have time for a question and answer period. So you're not just being discharged with a load of paper and, hey, good luck, you know, or here's a quick demo of how to clean this port, and you're so stressed out that you didn't even see it. And you don't have time, you know, they don't give you a chance to say, hey, can you do that again? But the downside of the CARE Act, which is that nobody knows about it. And, you know, ARP was the group, I was the lobbyist who got it passed in 2015, and unfortunately passed the first year. We expected to fight for it for several years, and by then have a bunch of advocates aware of it. But it passed so quickly under the radar, it passed unanimously, that no one really heard about it. And we've done a poor job of making people aware of it since. And Gordon is like, you know, this is a great thing. Why don't older adults and their family caregivers know about it? So if you can help us get the word out through these wallet cards that come in an 11x7 piece of paper, but you just cut out the bottom and fold it over, and it becomes the size of a wallet card, scotch tape the edges, and you've got a card that you can present at the hospital that says, here's, you know, what rights I have.
Excellent. Thanks, David. We will do all we can to, you know, get some momentum behind that.
Yeah, and you can brand it VCC. We can co-brand it. You know, there's already one available. You can download it on the ARP website. It's arp.org/wallet cards with an S. And then you scroll down to find Virginia, because there's basically one for like 35 different states. We were the third state to pass it, so we're at the top of the list, but we're probably last in getting the word out there. But if you want one branded with VCC, we'll pay for that.
Okay, thank you, David. It's great. George, anything from the Dementia Care Coordinator?
Thanks, Chris. So I just want to let everybody know that the Dementia Roadmap is available on the Dementia Services website. I'll pop that in the chat. Also, the Home Safety Information Toolkit and our tip sheets. We're going to be launching the new Dementia Capable Virginia webpage sometime in the next 2 weeks. I'm just putting the final edits on that. So that'll bring all those resources for families, for providers under one URL. So you'll be able to find everything there. And I'll let Nick and Liza know when that page is launched, so they'll be able to share it with you. So thanks.
Thank you so much for all of that work. I've actually already been sharing it with clients and families.
Great. Yeah, in that roadmap, the roadmap is really a terrific piece. It really is. Nice work.
George,
Kathy,
are you going to, just quick question, George, are you going to distribute hard copies of those?
Yes, we're just working out how many we're going to be able to print. So printing costs have gone up substantially since we started the project, and we're probably not going to be able to print as many as we'd like, but hopefully we'll be able to make those available to AAAs and other interested organizations. I'd say it's going to be a little bit longer than I'd hoped. I thought it was going to be in February, but it's probably going to be in April.
Do you have a scan device that, say, example, at the Brain Health Initiative, where people could get to that on the website?
You mean like a QR code?
Yeah.
To link them to where?
The website to get to the roadmap? Because I was thinking we could hand out hard copies at that, but.
Wait, sorry, I'm a little confused, Dee, sorry.
So if you don't have hard copies to hand out, and we're at a fair.
Oh, right.
Do you have a QR code you can post?
No, I can certainly I can certainly put one together though. So
okay, thank you.
Yeah, I'll organize that. Thanks. That's a good suggestion.
DM also
Really
has
is.
filled it out for the VCC guide, probably.
Okay,
It's wonderful. I didn't even think of that. So
that's great. What a good idea. Kathy, anything from DARS?
Well, as everyone knows, the General Assembly session just ended. However, the budget was not finalized, so the governor will have to bring the legislators back for a special session, I guess, to approve the budget. And we did have some budget items in there. We had a couple of things that went in through Governor Northam's budget that so far are still in there, which, you know, we're keeping our fingers crossed. One was funding for to continue the senior legal helpline that we used to have that was grant funded, and that was offered through the Virginia Poverty Law Center. And then also additional funding for our VICAP program that provides free and unbiased Medicare counseling for individuals. So, you know, we're just keeping our fingers crossed, and hopefully I'll be able to give you an update as to what actually went through at the next meeting.
Okay, thanks, Kathy. I appreciate that. So Donna, would you like to introduce Kevin for us, please?
Yes, I would. Kevin, are you ready?
Yes. Hello, everybody.
Okay, so Kevin is going to be talking to us. I don't know how many of you know that, you know, DARS has several different divisions in community living, and Centers for Independent Living is one of them. So Kevin Kojal is the director of independent living at DARS. He's going to be talking to us about how the Centers for Independent Living improve the lives of people with disabilities. He leads a team that works with Virginia's network of Centers for Independent Living to maximize the leadership, empowerment, independence, and full inclusion of individuals with disabilities across the Commonwealth through monitoring and evaluation, technical assistance, quality assurance, policy leadership, grants administration, and program coordination and development. But more importantly, Kevin is a dedicated cheeseburger enthusiast, and as a fan of the Washington football team, he wants you to know that he always has hope. Kevin?
Thank you, Donna. It's lovely to be here with anybody. I was very pleased to log on to this meeting just in time to hear that the Commodores are still playing out. So that's wonderful to hear. I'm going to try, I think, to share my screen. If I can do this, it's always a little bit of a adventure. Can everybody see that okay?
Yeah, good job.
Wonderful. Hey, I've accomplished something today. Well, again, it's wonderful to be here. This is the first time that I've had an opportunity to attend and connect with you. So it's a wonderful opportunity to begin hopefully some conversations and some relationship building around Centers for Independent Living across Virginia. And I did want to ask you, I hope you're just seeing the main slide in not my kind of view. Is that right? Yeah.
That's right.
Great. And as Donna mentioned, my name's Kevin Kojal. My title here at DARS is Director of Independent Living. DARS is a major funder and supporter of Centers for Independent Living across Virginia. And my office is located in the Office for Disability Programs. So we're in the same division as Aging Services, albeit in a separate building from Nick and George and Kathy and those great folks over there. So we are really lucky to have such great colleagues here. So I wanted to talk a little bit today sort of about Centers for Independent Living. I don't necessarily know how much folks in this meeting know about these wonderful organizations, and kind of invite you as I take you through some information to think about ways that CILs, as they're called, can be resources for you and the people you support and serve, and perhaps those in your lives. And there, I am in this role because I firmly believe in the power of these organizations. They're very unique, and we have a wonderful opportunity at DARS to support them. So in the next 25 minutes or so, I'd like to sort of give you some background and overview of what independent living is and what it means, and what Centers for Independent Living in Virginia do, particularly with some information on services. And I forgot to mention George is also in the aging side of things. George, sorry about that. I didn't mean to overlook you there. To provide some information about the services that CILS provide for people with disabilities and families and caregivers. And I'd like to kind of weave some examples throughout that I hope will illustrate some ways that you may be able to connect with these really important organizations throughout the state. So this slide has a sort of two hands kind of supporting some pictures. One picture is kind of a group of people that's meant to kind of illustrate independence through community. Another has a picture of a ramp providing access to a building, and that's meant to kind of signify the idea of independence through access. And then a picture of an eviction notice with a all too familiar mask these days. It's really meant to signify independence through housing and medical support and personal care support. And I want to kind of start by sharing three stories with you that I think are really powerful in illustrating what Centers for Independent Living are all about. So the first is a story about our center here in Richmond. And like a lot of CILs across the state, RIL, Resources for Independent Living, provides transition services for people with disabilities in nursing homes who want to move back into community living situations. And RIL worked with a woman named Macy, who's an older Virginia, and her family to support this transition from a nursing home, and working together with Macy, who wanted to move out of this facility for fear of contracting COVID initially, but ultimately to be more independent. Staff at RIL was able to locate an affordable unit close to her family and facilitate needed accessibility modifications. And now she has an accessible bathroom, lives comfortably close to her family in her new apartment. She was able to get access to a laptop computer and scheduling support for telehealth visits to access medical professionals, and is a more direct part of her family's life. So she's able to be involved as closer in proximity to them and with much more connection. Another story I want to share with you is about Hassan and Mia, whose family was facing eviction and had lost their personal care attendant services for their child with a disability. Child's name was Marco, and this was the result of the pandemic. And so they worked with the Center for Independent Living, called Independence Resource Center in Charlottesville, to locate and find and train a replacement attendant care services. They, through some advocacy and support that the center provided them, were able to develop some skills and ultimately reach an agreement to work with their landlord to remain in their home. Ultimately, the landlord lowered the rent, believe it or not. And then they, together working with the center, were able to locate some bridge funding to soften some of the financial and personal crisis that the pandemic caused for them. And then the third story I want to share with you by way of introduction comes from some work that our center way out in Southwest Virginia in Rocky Mount did to support a consumer in achieving community access, which we all know begins at home. And so this center received a call from an older Virginian's sister from Franklin County. And he had Parkinson's disease and diabetes, which both, as you all likely know, can impact people's ability to stand and walk. And so she knew that he wanted and was looking to figure out a way to safely get out of his home so he could access community resources and activities and things like that. And he said he was afraid to take a step down from the inside of his house because of narrow steps in front, and it had some previous falls. And so even basic tasks like running errands and things like that had become a challenge. And so working with the consumer, they developed some goals together, and then the center and the consumer collaborated with a local nonprofit to ultimately bring a ramp to and a platform to the front door of his home, so that he could come and go freely from his house without taking a step down. And now he's able to get out into the community to run errands, to make appointments in a safe way. And I share these stories with you by way of introduction because I think they illustrate something fundamental about what in this world we mean by independent living. And really we mean people with disabilities, families, and caregivers realizing their goals for empowerment, independence, quality of life, and inclusion in their communities. And if you look in the Virginians with Disabilities Act, in the section that has to do with our agency, and in fact uses language like that to sort of describe and articulate the goals that both DARS and the center share for empowering people with disabilities and caregivers and families toward independence. And so I really like to think of each center, and there are 17 across the state and 3 satellites, and we'll get into a little more details on this. I like to think of each center as kind of a touchstone or kind of a nexus for supporting this idea on the ground in the communities that they serve. So just a little background on independent living, because it's really fundamental to the work, as I said, on the ground, that I'm going to provide a little more information on later. Independent living means a particular thing in this context. And really you can think about it as a social movement, which ultimately sort of in ways, is for sure is still going on. But one of the big achievements in the 60s and 70s was the passage of the Rehabilitation Act. But this movement continues today in a very robust way. So independent living is a movement. Independent living is also a philosophy and a set of values. And independent living means a set of programs and services that Centers for Independent Living provide. So as a movement, independent living has involved, it really got a lot of play in the 50s and 60s and publicity in the 50s and 60s. And if you haven't seen the movie Crip Camp on Netflix, that's a wonderful way of learning about independent living as a movement. But it traces back to the turn of the century, where mobilization began by people who were marginalized because of their disabilities. It really involves, as a movement, the struggle by people with disabilities to attain the same civil rights opportunities and control over their lives as other people. And this slide is meant to illustrate some really fundamental concepts that are attached to the movement. So one is the idea of deinstitutionalization. So a value of independent living is that people should be in and be part of their communities rather than secluded in institutions. Demedicalization is another important value in independent living. And demedicalization is kind of a pushback or a corollary in some ways to what has been termed the medical model of disability. And that is to say that the medical community has a critical role to play, but doesn't necessarily have ultimate authority over how people should live their lives, and that people with disabilities themselves, not only medical professionals, can determine how they want to live their lives. Self-help is a really important part of independent living, and self-help kind of gets trivialized in the section of Barnes and Noble as in some ways as kind of a pop psychologizing or something like that. But it's a critically important part of the value set here, in that it represents the idea that people with disabilities can become empowered through knowledge, and that's made robust in learning in and through communities and peer support. And community development and peer support is really a fundamental value to how SILS work. It's a peer support model in many ways that aims toward kind of self-advocacy as a goal, and the access to services. And then consumerism has been a really important part, and that also gets a kind of a pejorative slant. But in this context, it's meant to articulate the value that people with disabilities know best what they need, and should have choices and options in the goods and services that they choose to use. So I want to share a story about Henry now. And Henry was living on the streets and in a homeless shelter in Charlottesville after the death of his mother, who was his primary caregiver. And those of us who work with caregivers understand that that can be a really difficult and traumatic and in some ways dark time for people with disabilities, when caregivers are no longer able to provide that. And he was living on the streets, as I mentioned, and he was also living with cerebral palsy, and he was a power wheelchair user, and he acquired pneumonia and sepsis while he was at the homeless shelter, and that ultimately led to congestive heart failure. And after 2 months in ICU, he transferred to a rehab center in Locust Hill, Virginia, on the Middle Peninsula. And he had a goal. He didn't want to stay at the rehab center, and he had not given up on his goals of living and working in the community. And so he connected, actually through a DARS vocational rehabilitation counselor, with the Peninsula Center for Independent Living in Hampton, and he requested some help transitioning from the rehab center. He said, look, I have a goal, and I want to leave this institution. And as I mentioned in the beginning, that's a service that centers can help provide. And so pooling efforts with the Peninsula Center and DARS vocational rehab, they worked with Henry to kind of overcome some of the obstacles in the transition, most notably finding suitable housing and a job. Working together, they located an apartment and arranged for furniture and personal assistant services. And DARS VR helped with some rent and utility payments and home modifications and things like that to help with the accessibility. In fact, they were able to figure out how to put keyless entry in a phone app to help him unlock the door remotely. And then he worked with the center to develop some skills, and skill support is another service that centers provide that I'll describe a little more in a little more detailed way in a minute, to maintain his new lifestyle. And he decided with peer counselors at the center that he wanted to become an advocate for independent living. He wanted to work in this field, and he was ultimately hired. And now he works helping others with disabilities in maintaining their independence and living in the community, and continues to educate himself, and really has with the support of the SIL and others, has realized in many ways one of his key independent living goals. And so independent living as a philosophy, as well as a movement, is guided by values that some of which I've mentioned, like consumer control, choice, empowerment, self-determination, advocacy, things like that. And also is guided by the idea that people with disabilities are the best experts on their own needs, and that voice should be very present in conversations and goals that people have for themselves. Another critical part of the philosophy of the work that we do is that having a disability doesn't equate to having an illness. It's not something that needs to be fixed in kind of a medical way, and that no one should have to live in an institution solely because of a disability. Another sort of key values here are that people with disabilities should really be viewed as citizens first, and only secondarily as consumers of healthcare, rehab, and social services. And so often people with disabilities are, that is kind of flipped and are defined by the services that they may want and need, and not as a person in that the holistic sense. Another key sort of value of the philosophy here is that barriers are omnipresent, as all of us know: physical, communication, programmatic, attitudinal, and they should be removed. And people with disabilities should have continue to work and achieve the overcoming of those barriers. And finally, a core value in independent living is that leadership itself should be vested in people with disabilities. And so people with disabilities through centers organize and take initiative, and individually and collectively to advocate. And that's another really key part of what distinguishes centers. If there were two things that I would want you to take away that really define centers, they are the peer support-based model and the solidarity and community that's established through that, and the idea of the development of self-advocacy. And then finally, as a program, and this is really where the rubber meets the road with the centers that DARS supports, are the centers themselves who do the work. And so on this slide, these are 5 distinguishing characteristics of what a center for independent living is. So they are a consumer-controlled, community-based, cross-disability, non-residential, private nonprofit. And they're designed and operated by people with disabilities for people with disabilities. And so consumer-controlled in this context means, and this is what makes SILS unique, is that the majority of staff and board members have to have disabilities themselves. So this is about peer support and people with disabilities guiding the agendas of these organizations. SILS are also unique in some ways in that they offer the same services to all individuals regardless of disability. So they are cross-disability organizations. And they are non-residential. They don't operate residential programs, meaning that they are focused on helping people achieve independence in the communities that they live in, using integrated and inclusive opportunities. So that's what a center really defines what a center is. And I do want to point out that another part of this is that centers are places of advocacy and coalition. And so with peer support, they are places where people with disabilities can go to develop skills to advocate for their own goals, to become empowered to meet their own independent living needs and achieve what they want to achieve. And so I'm going to share a story about how this kind of plays out with young people with disabilities. And I know there are many caregivers who have children with disabilities. And so the center in Northern Virginia has a program called I Am Self-Advocacy that's a partnership between Independent Center of Northern Virginia and our DARS, what are called pre-employment transition services. And those are services for youth. And so over the past few months, mentors from the center have worked with a group of 6 students with disabilities from Fairfax County. And these young people have learned about topics such as disability awareness and requesting accommodations, setting goals, and they're meeting weekly with peer mentors who are exploring these topics with them. The students are growing enormously, and parents have said things like, watching my child start out quiet and grow to want to advocate for themselves and others is powerful. And it's truly inspirational to watch the transformation of my son to be a self-advocate. And so I think it's a lovely kind of example that captures an important role that SILs play in supporting young people with disabilities. This slide is a map that identifies the areas of the state that Centers for Independent Living, where they're located. And you can kind of see, I don't know how clear it is from this map, but certainly I can send additional information if that would be helpful with locations, and you can find them on our website. But we have most of the state covered by centers. There are 17 kind of fully operational SILs, and I'll explain what that means in a second. And there are a few unserved areas. Those white areas are unserved, and the gray areas on the map, so Middle Peninsula and just below Richmond, are satellite centers. There's also one in Loudoun that are that offer many but not all of the services that a fully operational SIL would be able to provide. So you can kind of see we have pretty good statewide coverage. We are always trying to do what we can to move the needle and get full statewide coverage. And you can probably also see from the map that centers are organized in terms of their service area by planning district. And so most centers serve 4 to 5 counties and maybe one of the independent cities or several of the independent cities in that area. So you can kind of probably see in the southwestern part of the state that some of the centers there cover a lot of ground. And so many out there will have sort of ancillary offices that folks can access. So they really do strive to make it as easy as possible for folks to get to them. And one of the silver linings of the pandemic, if there are any, is that many of them are able to do more virtual services. So you're gaining skills and confidence in doing that. So so that's a good thing. So this slide identifies for you the 5 core, what we call core services that all centers have to provide to be a center for independent living. So you could go or connect someone to any of the centers in the state, and they would be positioned to provide these 5 core services. And I'm going to describe them briefly. And I should say that Nick and Liza and Donna, I'm happy to share contact information, and if folks at the meeting would like to sort of talk offline in more detailed ways, I'm happy to have some phone calls or whatever. So if you can share my contact info with the group, that would be great.
I'll put it in the chat while you're talking.
Great, thanks, Donna. So the 5 core services that define centers are independent living skills training, peer counseling, information and referral, individual and systems level advocacy, and the newest one, transition services. And so I'm going to walk you through very briefly these 5. So independent living skills training are supports that are developed through a plan, what's called an independent living plan, that the consumer and staff at the centers develop together. And one of the services, and that plan articulates a goal that someone would have, and there are 12 different life areas ranging from self-care to communication to housing, transportation, those kinds of things, across what you might consider major domains of living. And so folks collaborate with center staff and develop a plan that kind of describes the goals they have for themselves to become more independent in various areas in their life. And one service that can be provided by the center to support and advance this is independent living skills training. And this is kind of what it sounds like. It's skill acquisition to help someone develop their ability to function independently or more independently on a daily basis. And so this is provided in areas like meal planning and preparation, or grocery shopping, or laundry, or self-care, a lot of budgeting and personal finance kinds of things, financial management, maybe getting to and from work on time, decision-making, self-advocacy, so asking for accommodations at work or in the community, communicating effectively, maintaining a household. There's a broad range of kind of skills support that can be provided to folks who would like it. A second service is peer counseling, and this is a sort of a mentoring relationship, if that makes sense, where staff at centers will provide counseling and guidance and information sharing. This is provided by individuals with disabilities to individuals with disabilities. As I mentioned, one of the requirements of centers is that they have on staff a majority of people who have disabilities themselves, and those folks are hired generally on the basis of their working on and achieving their own independent living goals, and so they bring some expertise on that or some perspective. And so that's a really wonderful way for people to get support, kind of been there, done that kinds of things. And it's very much an informal model. It is not a it's not a traditional kind of counseling in like the psychiatric or psychological sense. It's a very informal relationship of mentorship. And so that can complement other kinds of traditional therapies folks are getting. And as I mentioned, peer counselors really have knowledge that they glean from personal experiences. So things like accessing Medicaid services and waivers is really big. That, local knowledge on that can be really helpful, as we probably all know. And personal assistance services, accessing those and getting benefits. Benefits counseling is something that folks access peer counseling services for. So understanding benefits, maximizing benefits, and also understanding how benefits are impacted in various ways as people, let's say, want to go to work or things like that. Also, assistive technology options and what works for folks is something that you see in that space. The third service is information and referral. This is available to everybody, whether someone has a disability or not. And this is what it kind of sounds like and what we're all familiar with, where current information on resources, equipment, programs, things like that are provided to the public. So people can call or go to centers and ask questions about resources. And SILS will refer to other agencies. They typically maintain good relationships and can network and help people in that way. And then the fourth kind of service is advocacy, which is individual advocacy. So centers will help people gain advocacy skills. We'll also advocate on behalf of people. We had a really great example in the last few months of a SIL helping resolve, I think it was 5 employment discrimination issues that people came to them with, working with the employers to help people avoid getting fired or not getting promoted because the employers didn't really know how to navigate with assistive technology and what accommodations could be afforded on the job. And the center was, and the folks were successful in avoiding any of these kind of negative actions. So that's an example of individual advocacy. It happens in the housing space. A lot of centers support folks with IEPs, in education, and other community programs or services. And then SIL staff and centers across the network kind of bind together to do systems advocacy work to change policy and procedures and practices at the state and local levels to increase accessibility. So you'll see a lot of coalition building and changes going on around greater equality in things like physical accessibility. And an example of this would be the SIL in Fredericksburg was really successful working with local officials to get policies in place so that people, when the restaurants were going to the outdoor dining in COVID and kind of impacting the accessibility of sidewalks, the center was able to help work with the locality to ensure that there was both needs could be met, and then people in wheelchairs, for example, could still access the sidewalks and things like that. And then the final core service is our transition services. And there are three parts to this, and I'll just be very brief. So transition services involve support for young adults with significant disabilities who are leaving or have graduated K-12 education and are entering adulthood. And we all know that when the school services stop, there's a cliff that can often be very difficult to navigate. And so SILs are really targeting, doing a lot of outreach and developing relationships and services for youth who are transitioning to adulthood so that they can realize their independent living goals and continue that pathway from school. Transition services, and I mentioned this a couple times, also involves helping people get out of nursing homes and other institutions, live in the community if they want to, and also to support people who are at risk, who say, look, I'm nervous, I'm going to have to go to a nursing home if I don't get X, and they can help try to do what they can to help people access services and support so they don't have to go to an institution if they want to avoid it. And I'll share with you a couple of very brief stories to illustrate a little bit of this, but the center in Harrisonburg called Valley Associates for Independent Living worked with a consumer who is at risk financially, learning that the cost of her med, she's on Medicare, and she learned that the cost of her annual medications would be $7,585 a year. And so she worked with the center, and she kind of was supported in doing some of her own research and learning about alternatives and discussing them. And I frankly don't know if VICAP was involved, but I would, with the relationships they have with the AAA there, I wouldn't be surprised. But as a result of this, the consumer was able to change their plans, reducing the annual cost from $7,500, a little over, to $2,500. So roughly saving her $5,000 a year, which would have maybe put her at risk for more restrictive living if those finances couldn't be managed. Another story is about a 78-year-old veteran who had multiple disabilities connected to his military service, particularly around Agent Orange exposure. And he was going to have to go to a nursing home because his home was not accessible and he was not able to continue to age in place. And so he was a high fall risk, and he wanted to help transform his home into something accessible so he could avoid institutionalization. And so he worked with the SIL to install a roll-in shower and some other accessibility modifications to access some grants. And over 5 months, they were able to accomplish this. And just at that point, he learned that he was going to have surgery and would need 6 to 8 weeks of recovery in his home and would not have been able to do it in his home without those modifications. So it's a really nice example of how that was supported. Sort of in closing here, I'm going to just highlight a few other services. So I mentioned the 5 core services. There's an array of other independent living services that CILs across the state can offer. Some do, some don't. And I would encourage you to, as you hopefully connect people to centers that may be able to support them. One of the ideas of centers is there to be responsive to community needs. So when the local disability communicates that there are things that they would like or things they need or want, if it fits within the framework of these kind of other services, CILs can provide it. So it's a really nice model of responsiveness. So some of these other services are housing services where they can help folks locate and gain accessible housing with modifications and things like that I've mentioned. Helping arrange for and support people's skills on accessing transportation, advocating for demand response instruction and utilizing it, that kind of thing. Services that support long-term employment, so work incentives and benefits, counseling. A lot of CILs do Medicaid waiver facilitation, things like that. Centers will do what they can to help raise awareness about disability issues locally and provide technical assistance to local governments and businesses. Many centers are active with helping people access and providing assistive technology and durable medical equipment. So for example, the center in Fredericksburg, and this is really, this exemplifies a number of different opportunities across the state through centers. They have a kind of a durable medical equipment rehabbing program where they acquire, fix, and make usable again wheelchairs, hospital beds, accessibility equipment like walkers and canes and lifts and things like that, and then are able to give it to local residents free of charge. And the Fredericksburg Center routinely gives out over 2,000 pieces of equipment free to local residents who might not be able to afford them because of lack of insurance coverage or things like that. And they can also, as I mentioned in describing advocacy, help people resolve disputes that they're having with services. So that's a wonderful, albeit brief, description of some of the other major services, but there are many, and I would be happy to talk with you more about that. By way of closing, I'll just share with you, to exemplify this, 2 stories, one from the Fredericksburg Center, which I mentioned, that in addition to their durable medical equipment program, has a program called Giving Back Sound that helps connect consumers who cannot afford but need hearing aids and other assistive technology at low or no cost. And recently, the center helped an older Virginia obtain hearing aids through a local provider. And the staff, this is a quote, the staff explained that he got in the car and started to cry. He could hear the raindrops on his windshield. He's in his 90s and now enjoys time with his family. So that's a lovely example of kind of another way that this CIL supported this person. And then finally, the CIL in Rocky Mount, a great example is a young person who's being raised by his grandmother, had an IEP in the public school system and was having a lot of challenges. The grandmother was having a lot of challenges getting him the help he needed to move into his senior year. And so at the end of May, this was last year, 2021, the 4 days were left in school, and he was ready to get out. And they get to the WISE test, and the school says, you can't take it, so you can't graduate. It's 4 days before graduation. And he's got tons of ADHD, and he was, just remembering the information from the fall before was a stretch. And the lack of accommodations and things like this on the test made the school division decide to just push him off another year. And so working collaboratively with the grandmother and grandson and the school, they were able to figure out with the school in a short amount of time how to get the accommodations in place, and he took the test and graduated. So another nice example of how I think the centers can support families and young people with disabilities. So I think I will leave it there, and I am happy. I think we have a little time left. Yeah.
Kevin, I actually have a question, and then you can open it up. There are lots of comments in the chat.
Okay.
Does accessing any of these services cost the individual money?
Yes, thank you for that question. The answer is in almost all cases, no. Certainly all of the services that DARS funds, the core services and other services, are free. There are some very, very rare examples where, you know, a SIL will have like a sign language class, and they might charge materials costs to participants, things like that. But like 99% of everything is free of charge, and that's a really great question. I appreciate you raising that.
Does anyone else have questions? Sharon, I know you asked a question in the chat. Would you like to?
Yes.
Go ahead.
I was wondering, when you showed the map and you had the areas that basically are non-centered areas that don't have centers, yes, those folks who live in those areas, what center are they supposed to contact in terms of trying to get services for them? Or do the centers cross lines when they're providing services?
Yeah, thank you. It's a great question. So, you know, unfortunately, in unserved areas, it can be difficult for folks to get center services just because of the geography. That being said, I would very much recommend folks contact the center in a adjoining catchment area. Certainly, I do know that the SILs will do what they can to provide services in unserved areas. Some can travel into them. Some will do things virtually. But it is also an opportunity to advocate for full state coverage. So I think that's a critical need. But yeah, it's a little bit of a not so predictable. But I would definitely encourage folks to reach out because they will typically do what they can to help.
Hi, Kevin. I'm Colleen Downs with Senior Services of Southeastern Virginia. Great presentation, and I'm familiar with the Independence Center out here on Virginia Beach Boulevard. One of the new things that you shared that I wasn't aware of, that do you know if the one out here in Norfolk assists veterans also with disabilities? That was the newest information that I heard.
Yeah, so there's no restriction on that. And as I mentioned, centers are cross-disability organizations. So if somebody with a disability comes to them and says, there's an important part of the model is there's no eligibility other than someone has to say, I have a significant disability, or I have a disability that's impacting my independence. That's really critical. And that's kind of illustrates how it's different than the kind of medical model, if you will, where there's a diagnosis and eligibility determination. So veterans can certainly come to SILs. I will say, Colleen, that one of the things that's great about Independence Center there is they're very networked into the local options and also state options. So they are also able to connect veterans to services and refer them and collaborate and advocate for services that may already be existing. But any of the core services that I described would be available to anybody with a disability.
Thank you so much.
Glendora, do you want to ask your question?
Yes, thank you. Excellent presentation. Thank you so much, Kevin, and everybody else.
I am the new outreach and communications coordinator here in Radford for Disability Resource Center. And one of the challenges that we have is I'm just looking for what everybody else is doing as it relates to transition services within our scope and our strategic plans to assist persons leaving incarceration with services applicable to how they need to live. Because as you know, and I'm sure many of you know more than we've probably ever discussed, there's a huge population of persons living with a disability who are incarcerated, not just in Virginia. And so trying to get back in, my previous role was a chaplain in a jail, okay? And so working with people in recovery, society isn't really welcoming to say that's a disability, but legally it is. So is anybody doing anything, Kevin? What's your thoughts? I need your help.
Yeah, I mean, so I'm glad you brought that up because the transition services that I described are helping people transition from institutions. So, we often think about nursing homes in this space, but there is, I can tell you, I don't see a ton of work around transitioning from prisons for people with disabilities, except through the SILs and some of the SILs involvement, like in their local continuum of care coalitions on reentry for folks who are at risk of homelessness. But I think it's a really great opportunity, and so I would encourage folks to connect with the SIL, and I could help sort of be a conduit for that. Because if there are people who are coming out of prisons who want and need access to community services, the SIL should be able to be involved in that and help connect folks to the services that may exist. I will say that in a kind of related way, Glendra, we are starting a pilot at DARS with 3 of our centers who are going to be working through specifically with youth to provide peer youth who are, I guess the term is justice involved. I hate these terms because they're like really, but you got to talk about it. So they're justice involved youth who are either in some way involved in the pipeline of the juvenile justice system or exiting, to provide peer mentoring services around self-advocacy and employment. So there is some like work going on in that space, which I think is kind of related, but not exactly to what you're saying. So I'm optimistic that the conversation is becoming more inclusive of people in prisons, but I would love to talk more about that. So,
well, I got your email, so thank you.
So in the chat, Dee also says that they have a new grant for employment assistance that helps with that transition. So that might be something to think about for you.
Definitely. I'll go back and pull up the chat, trace that back.
In the chat, Kim, did you want to ask your question?
Yes, I actually have a couple of questions. So the first one is a follow-up for the facilities that are offering that pilot program for youth. What are those facilities? Where are they located?
The center. So so the centers are the center in Harrisonburg, Northern Virginia, and Hampton.
Okay. I also work with justice involved youth in a part-time capacity at another agency. So that's why I was asking. I didn't know if it was in Fredericksburg. Yeah.
And if you want to email me, I mean, there's a kind of there's a prep and a training component, but when this goes live, there's a need. I mean, there's some collaborations with like other state agencies, but there's going to be a need to find and locate folks. And so if that is something that you may be able to potentially be helpful with or with other things, I'd love to connect you to to the folks who are involved.
Yeah, I'd love to get you connected with either my ED over at the other organization or the Fredericksburg Regional Program Director.
Right. Yeah.
Whichever would be helpful. The other question that I have is, so I noticed that you were saying that there aren't really any like eligibility criteria. Are people able to access like some of the services, if not all of the services? Like if somebody wants to access just the life skills training part, are they able to access that?
Sure. So yes. So the eligibility is that someone has to come to a SIL, and and one of the I don't want to get too into the weeds, but the centers determine eligibility independently. So there's no centralized kind of DARS test or anything like that. So, but people self-identify as having a disability. Basically, it's called significant disability, and that's defined sort of in the regs as a severe physical or mental impairment that impacts participation in the community, family, employment, that kind of stuff. So if they are having that, and they don't really have to come in and announce that, they can sort of meet with staff, and if that's the case, they identify in that way, and then there are services at the center that can be helpful, like independent living skills support, then they would develop a goal in the plan that would involve that service. And those plans can have one or multiple services being provided at the same time. So yeah. So the answer is yes. Sorry, that's a long-winded answer. I should have just said yes.
Well, no, it's helpful because it helps me understand the process and everything. So I appreciate it.
And before I forget, I mentioned that pilot. I don't want to neglect it. It is justice-involved youth and also youth in the foster care system. So both of those are underserved by DARS. And this is kind of a collaboration with the vocational rehab side of the house. So yeah, so that's exciting. We hope that will be successful and we'll scale it up.
Anybody else?
This is Sharon. Can I ask one more question, please?
Yeah, absolutely. Go ahead.
I've listened, I mean, in terms of the descriptions and the things that you said. So would an individual who had a mental health diagnosis qualify for services? Let's say they had a mental health diagnosis and also had, which is an individual I'm working with now, a TBI. Would they then qualify for services, and could they qualify with their mental health diagnosis alone?
Sure. There's no restriction on disabilities. It's really about the impact that it has in someone's life. So it's a different model than asking for a diagnostic category or a label. And so, for record keeping purposes, people are grouped into very large categories. So a mental disability is one of them. I don't really love that phrasing in our record keeping, but there's no restriction. The only caveat would be, when they meet with staff and talk through what their goals are, a big part of the process is for the person to set goals for themselves. If the SIL can serve them through those services, they certainly would be eligible. There's really, not an eligibility issue. I'm not saying that exactly the right way, but eligibility is not sort of determined or vetted in traditional ways. It really is meant to come from the person identifying what their needs are, how their disability is impacting their own achieving or progress toward their goals. I'm not saying it exactly right, but I hope that makes part of the point.
Anybody else? I think we have time for maybe one more question if you've got one.
I have one question. Is this an initiative that's unique to Virginia, or are you aware of other initiatives like this in other states?
So Centers for Independent Living themselves.
Mm-hmm.
So yes, they're national. So they're actually codified in the Rehab Act of 73. So there are, I think, roughly 420. I'm not going to get that exactly right, but across the country. But Virginia is really, we're a very fortunate state because kind of pound for pound, if you will, we have a fairly high number given our size. So for example, the state of Utah, which I think is much bigger than Virginia, has 6 that has to serve the whole state, and we have 17. So we're fortunate. But yes, it is a national, there are centers in every state.
Okay. Do you know the best way to search to find out what centers are in what locations? Because I have a client in like a different state that really could utilize this.
Yeah. There are 2 places I would go. You can go to a website called the National Council for Independent Living, nicil.org, and they will have a national listing. You could also Google ACL, Administration for Community Living, and Centers for Independent Living, and they would have a list. And if you have any trouble, just email me and I'll get you pointed right.
Thank you so much.
Sure.
So thank you very much, Kevin. I would encourage you to flip back through the chat log just to see what some of the other comments were, as you go. And I thank you, and I appreciate particularly the one statement you made, that disability is not an illness that needs to be fixed or cured. And I think that's just a really great perspective for everyone to leave this on. And I'm tossing to Chris Newfer, Mr. Chair.
Okay, thanks everybody for joining us. I hope you can attend the rest of the meetings this year. Just briefly mark your calendars. Next general meeting is May 19th. After that, we'll have one on July 21st, September 15th, and finish up the year on November 17th. So just a reminder, look for the survey with our slate of proposed officers, and please return that as soon as you can so we can do the counting, vote counting. Donna, Kevin, thank you guys both for another terrific program. Donna has done a fabulous job of fulfilling VCC's vision of introducing our members to innovative programming, and this is just another great example. Kevin, thank you so much. So look forward to seeing all of you on May 19th, and happy St. Patty's Day to everybody. See you soon.
Thanks, guys. Thank you.
Good to see you guys.